Obstructive sleep apnea is a disorder that occurs during sleep, and some people are very susceptible to complete or partial collapse of their airway during the night due to just the relaxation of the muscles of their throat and due to loss of reflexes that are there during the day that help to keep their airway open. Some people, like I said, are very susceptible to this, and what happens is if they're not able to keep their airway open during the course of the night, their oxygen levels will drop, their sleep will become disrupted, and that can lead to a whole bunch of nighttime symptoms and daytime symptoms. We have two different ways of testing for obstructive sleep apnea. So one is home sleep testing, and the other is taking them into the sleep lab to test them. A lot of people like home sleep testing just because it's done in their home environment, it's in their own bed, so they just feel more comfortable in that environment. Plus, it's less equipment that they actually have to use at night. So during home sleep testing, they have to wear an oxygen probe on their finger, they have to wear soft bands across their chest and their abdomen, and they have to wear like a little nasal cannula in their nose that is monitoring for their breathing. So all of those things put together can help assess whether their oxygen levels are stable at night or if they're having repetitive closure of their airway. We have all of those same parameters in the sleep lab, but we have even more parameters in that case. So we're looking at full EEG. So we can see if somebody is awake, asleep, how deep a sleep they're getting, are they getting all the different levels of sleep. We have full telemetry, so we know if their heart is having any arrhythmias or issues, and then we have EMG on their limbs to see if they're making any abnormal movements or kicking and jerking motions. So for people who we suspect may have more than just obstructive sleep apnea, the sleep lab is the correct place for us to do our evaluations. But when somebody has just a straight concern for obstructive sleep apnea, home sleep testing is actually a really efficient and oftentimes well-received way of doing that testing.